could your vitamin D levels be the culprit for miscarriages? Despite living in the sunshine state of Florida, I personally have found myself vitamin deficient many a times, despite laying outside during peak hours trying to get a suntan. It's unfortunately one of those things that we notice throughout the entire US right now, is that we are severely deficient in vitamin D, especially in the wintertime, but even in the summertime when we're outside more. In terms of our ancestors, we just don't get outside as much as we used to. And this was one of those things that I thought I could do on my own. I could not need to supplement it. I could just get outside and get more sunshine. But unfortunately, I don't have an outside job. Some of the things I do are more inside, and my levels were still low. So more than likely, you are also deficient. And it's one of those things that we don't always notice because the symptoms are very, very sneaky if we even notice them at all. Or they could feel like something else is going on as well. So some of the symptoms include muscle pain, they include bone pain, pins and needles in the hands and feet, muscle weakness, fatigue, wound healing, hair loss, depression, anxiety. Those are some of the symptoms that you'll notice. And you might think it's something else that's going on, because a lot of those symptoms can tie into the spine. When I work with chiropractic patients, some of those are things that they find, and it could be a pinched nerve. So it's very hard to tell, is it the pinched nerve or is it the vitamin D? So a lot of these symptoms are quite sneaky. And then in terms of fertility for males especially, they've noted low sperm counts, low sperm quality, as well as low T, so low testosterone, which are super important, all of these things, for producing a baby or producing sperm that is viable to get a woman pregnant. So when we're looking at fertility, especially miscarriages in that first trimester, a lot of it stems from dad and his health. So mom and dad could both be vitamin deficient. Now, all of this is disclaimer right here. I am not your medical doctor. I am not your doctor at all, unless we're working personally. So this is just information that I'm sharing with you, information that I found and information that I find with clients and couples I work with, in terms of vitamin D and all these different things. So if you need to reach out to me, definitely reach out to me. And if you're noticing that you have been supplementing with vitamin D and you get your blood test back and it's still not increasing, I wouldn't suggest personally increasing, or at least I wouldn't personally increase my vitamin D level. I would be looking into insulin resistance. It is something that I went over a couple weeks ago with you, and it can be a huge culprit also for tying into overall reproductive health. So someone could potentially be insulin resistant, and those levels, those vitamin D levels, just are not going to change. So that could be something that's also going on. There was a study published in the Journal of Nutrition in 1980, which showed that fertility was decreased by about 75% when vitamin D was deficient. And the study also showed that from day 6 through day 15, neonatal growth was impaired by 30%, so baby wasn't growing like it should. Now, these were in rat studies, but it still holds true for how it's going to function in a human and how it's going to function in other mammals, which is us, because it's not really ethical to try to convince a bunch of pregnant women that they should be science experiments, right? So doing some of these studies on rats, especially during that time frame, totally made sense, and is one of those things that we learned in the 80s and still don't always look into, is how vitamin D deficiency affects our overall health and reproductivity. So yeah, those are my thoughts on vitamin D deficiency and how it may contribute to miscarriages for both the male aspect of reproduction as well as female aspect. And I once thought that I could get everything from the sunshine and just go for my walks, but it does require a little bit more than that at this point. I still recommend, the morning sunshine walks and afternoon sunshine walks, and maybe reading out by the pool or the beach, or, just in the sunshine. But it does require a little bit more. So if you have any questions on vitamin D, definitely let me know. You can always reach out to me. I'd be happy to help you on your journey to preconception. I hope you have a great week, and you probably hear the dog in the back. Have a good day. Bye.